Hi, welcome to my channel. I'm Dr. Karen Thomas, and today we're going to talk about a research article. It has something to do with chronic low back pain and exercise. So if you are one who has had low back pain for over 12 weeks at any point in your life, that's chronic pain. Um, this may be of interest to you. And I want to do this because, I appreciate as someone in the healthcare arena that deciphering research is not always the easiest. It can sometimes be time consuming, especially if you are just having to look up different things in articles. And at the end of the day, you're like, what is this even saying? So it can be time consuming. So I am here to demystify some of that for you. So, weekly, I'll be going on my channel here and I'll be grabbing an article off the internet, something I think would be of interest to you that directly applies to you elevating your quality of life. And we're going to go through it. This is not going to be a painful process, I promise you. This is not going to be a painful process at all. I've read the article. I'll link it below. So if you want to dive deeper into the weeds and read up on it, feel free. But I'm going to give you the key takeaways and some highlights here, okay? So I'm sharing my screen so you can see which article we're going to talk about today. And this article is, it's out of a journal called Frontiers in Public Health from 2023. So November of 2023. So a more recent study. And it's called Exercise Intervention for Patients with Chronic Low Back Pain, a Systematic Review and Network Meta-Analysis. So a couple things before we start. Number one, chronic low back pain. So what is that? A lot of people tend to think that chronic low back pain is back pain that you must have had for years and years and years and years and years. And that's not actually the case. Technically, chronic low back pain is something that if you've experienced low back pain for longer than 12 weeks, that's 3 months, you have chronic low back pain. That is chronic low back pain. Back pain that's longer than 3 months. So, in my experience as a physical therapist, especially working with frontline professionals, the great majority of frontline professionals have chronic low back pain. It's just something that they deal with on the regular. It's not something that happens. It doesn't happen again for another year, 2 years, 3 years. It's kind of something that they tend to find themselves working through and managing all the time. So chronic low back pain, that's what that means. Also, you may be wondering, okay, systematic review, meta-analysis, like what is all of that? So I just want to touch on that because that's important when you are going on the internet and you're trying to find information about, you're just looking for answers. You're looking for answers to questions that you have. And not all literature, research, data out there is created equal, as we can imagine, right? So we want to make sure that we're finding the best stuff so we get the best answers. So let's look at what is evidence-based practice or evidence-based medicine. If you hear that something is evidence-based, like what does that even really mean? And then we'll talk about levels of evidence, and then we'll get into the article. So evidence-based practice is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of the individual patient. It means integrating individual clinical expertise with the best available external clinical evidence from systematic research. So maybe you're like, okay, I'm smelling what you're cooking a little bit. I'm a very visual learner, a very visual person. So I really like this graphic up here in the top left-hand corner. You can kind of see it. Let's see if I can. Oh yeah, let's make that a little bigger without deforming it. Okay, so if you're curious, okay, evidence-based medicine, evidence-based practice sounds important. What is it exactly again? That was a lot of words, and just sum it up for me. Here we go. So we've got clinical expertise, we've got research, and we've got patient values and preferences. All of those three things together make up evidence-based practice or evidence-based medicine, okay? So clinical expertise, that's like me as a physical therapist, your favorite physician, your favorite nurse, your favorite EMT, your favorite chiropractor, all of us doing the good work in the clinic, seeing what we see in our patient care operations, integrating concepts from research into practice, and us, forming opinions and concepts ourselves of, how does this all look? That is in the clinic, that is clinical expertise. That is a huge part of evidence-based practice. Best research evidence. So research. These are your articles, your journal articles, the current literature out there. And then lastly, we have patient values and preferences, the needs and wants of the patient or you, your needs, your wants. Let's say you're one right now who's like, I want to know what some of the better modes of exercise are for my low back pain. Well, that's an important part of this whole equation. And maybe you're one who flies a lot, or you are sitting in a dark room looking at screens for your job a lot. And you want, exercises that are maybe tailored to those types of career fields. That's important when you're looking at the big picture of, okay, so what articles are we going to pull from the research? Who out there practicing right now in medicine, physical medicine, could maybe help me with this? All of that together, clinical expertise, patient preferences and values, and then also research. All of those things make up evidence-based medicine or evidence-based practice. All right. So that being said, when we look at the evidence out there, specifically the research, there are different tiers of research, and this is just another source for you too. It just supports everything we just saw from, I think this was Duke University, posted it on their website. So American Physical Therapy Association also supports everything basically that was on the Duke University page. Components of evidence-based practice, talks about patient values and circumstances, clinical expertise, and best available evidence. All of that makes up evidence-based practice. Okay, but now we're moving on to levels of evidence. And let's see if I can get this to be a little bit bigger. That's pretty good. Okay. Okay, so you're like, yes, I get it, Dr. Karen. Okay, I'm going to go online and I'm going to find some journal articles where you're reading your favorite like weightlifting magazine or weightlifting book or running magazine, and you find that in an article there were some references, some links to some journal articles out there, and you're curious, like, well, how good are these articles? Like, are they legit? Are they reliable? So that's where levels of evidence come into play. And up here at the very top, these are your best, highest quality, most robust, most reliable pieces of evidence. And they include meta-analyses and systematic reviews. And those are what you want. If you're out there researching, or you're reading your favorite magazine and you see some references in there at the very end, and you're like, oh, I kind of wonder, you look and you're like, I wonder what type of level of evidence this is. Is this even good? Or is this just some random person's opinion who likes running or likes weightlifting, which isn't for us to disregard, but it's important to know when you're really making decisions about the things you love to do. So if it says meta-analysis or systematic review, and typically those levels of evidence are called out right in the title because it's kind of a big deal. They're kind of super important, reliable, and very robust. That's the good stuff. That's what you really want. As we move down in quality, we'll see randomized controlled trials next. Still very high in the grand scheme of things, still very good quality overall. So reliable typically. I'm happy to find those when I'm looking for answers to problems. And then as we just continue to go down, you see a bunch of different types of studies. And typically at the very bottom, in some other similar graphics, you'll find like expert opinion. So at the very top, what we really want, and I'll include randomized controlled trials in here, are meta-analyses, systematic reviews, and randomized controlled trials. Again, not to say that everything below that is to be discounted, because it's not. It all paints a picture in conjunction with, remember those other two big circles when we were talking about what evidence-based practice involves, patient values and preferences, and also clinical expertise. So it all just paints a picture But what we really want are these two at the top or these three at the top. All right. So that being said, let's dive into this article. All right. So again, like I said, I'm just going to give you some of the highlights, the takeaways. And again, this is about exercise interventions that are recommended for patients with chronic low back pain. So if you've had low back pain for over 12 weeks, over 3 months, the folks, the researchers, the authors of this article were looking at, what are the best modes of exercise out there? And by mode, I mean, is it core stabilization exercises? Is it Tai Chi? Is it Pilates? It's not talking about specific exercises like a back squat, heel raises, things of that nature. It's more modes or types of exercises. So what they basically started off by talking about was the huge problem of low back pain just globally, not just in the US, but all over the world. And it's pretty vast and a multi-billion-dollar problem, to say the very least. They do note exercise therapy is characterized by low harm, low cost, and easy implementation has become the first choice in clinical treatment of chronic low back pain. But they note it's unclear which exercise therapy is best. So that's what they're trying to get to the bottom of in this article. Studies that were published between 1998 and 2021, and they compared the effects of 20 different therapies on chronic low back pain. So 20 different therapies or modes of exercise. So when I read that, I was like, oh, this will be really good. And they included, just a wide assortment. We've got core stabilization exercises, yoga, the McKenzie exercises, aerobic exercise, Tai Chi, manual treatment. What else? Pilates, water-based physical activity. So they included virtual reality exercises. So they included quite a few different types of exercises. So they basically summarized by saying, our study provides evidence that active therapies such as Tai Chi, yoga, sling exercise, which I think is like aerial yoga, from what I understand, sling exercise, and core or stabilization exercises in which patients are guided and actively encouraged to move and exercise in a gradual manner are the most effective. So active therapies in which patients are guided and actively encouraged to move and exercise in a gradual manner are most effective. So that can include a lot of things. So let's look at some of the specifics, because I thought this was interesting. What's better at relieving pain over conventional rehabilitation and no intervention being provided? Here are your modes of exercise: Tai Chi, yoga, Pilates, sling exercise, motor control exercises, core or stabilization exercises, multimodal exercise, and McKenzie exercises. They're all better for pain relief compared to conventional rehabilitation and compared to no intervention being provided. So that's exciting, especially if you like any of those. I love yoga. So I was like, ooh, chronic low back pain, yoga, sign me up. All right. And then when it comes to improving physical function, they found yoga and core or stabilization exercises showed better physical function improvement than conventional rehabilitation and no intervention being provided. They did go into a bit more detail about a couple things, Tai Chi and also yoga. Specifically with Tai Chi, I thought it was interesting, though, where they note it can help improve proprioception. And proprioception does play a role in low back pain. So proprioception is, you can think of it as like the connection between your brain and body that has to do with where you are in space. So balance falls under this umbrella of proprioception. And what they note is by performing Tai Chi, it can actually help improve your proprioception through certain mechanisms in the brain. And I thought that was really interesting. You know, Tai Chi is one of those um, modes of exercise that I just haven't studied too much. And I thought that was really fascinating. I mean, I can definitely see how performing Tai Chi helps balance, but they go into a little bit more detail in this article about how, like, the mechanism behind it, rather, of how exactly your proprioception is improved by performing this. And I thought that was really interesting. And then they talk a little bit about yoga, a little bit more detail about yoga, and just it improves a multitude of different things in the body that helps combat chronic low back pain. Specifically, though, I thought it was interesting. Okay, here they say, in addition, yoga can effectively improve lumbar pain, low back pain, and spinal flexibility in patients with chronic low back pain. Here it is. Guidelines developed by the American Pain Society suggest that for chronic low back pain not alleviated by medication and self-management, consider recommending yoga as adjunctive therapy to help patients relieve pain. And I read that and I was like, I had to like reverse and go back to it, because I thought, so these guidelines suggest that for chronic low back pain not alleviated by medication and self-management, which it sounds like self-management and medication were the primary ways in which someone was managing their pain. They were like, well, then consider recommending yoga as adjunctive therapy to help patients relieve pain. And I mean, I think yoga is a fantastic frontline, like, first route. I think that yoga should be a frontline treatment, is what I'm saying. So I thought that was interesting. All right. So again, our study provides evidence that active therapies such as Tai Chi, yoga, sling exercise, and core stabilization exercises in which patients are guided and actively encouraged to move and exercise in a gradual manner are most effective. So where do we go from here? So what I'm going to do this month, every Wednesday, I'm going to go live on YouTube, on my YouTube channel. So excited. I'm just going to teach you some of my most favorite active therapy exercises, specific exercises. And what I thought we could look at is yoga. Let's look at core stabilization exercises, and let's look at some Pilates. How many of you have tried Pilates? Have you liked it? So, side note, I've tried Pilates multiple times. I've moved a lot in my career, and I've tried it in multiple cities. And I've done reformer-based Pilates, and I've done mat Pilates. And I actually think I had the most fun doing mat Pilates. So you don't need any fancy equipment for what I'm going to show you during the Pilates class. You just need maybe like a yoga mat on the ground, because we're going to be on the ground doing those exercises. But I thought, for the remaining Wednesdays this month, I'm going to go live, and let's take those active therapies that we know that are effective in helping reduce chronic low back pain, and I will show you some of my favorite specific exercises: yoga, Pilates, and core stabilization. Okay? All right. So there we are. So make sure that you subscribe to the channel so that you don't miss any new videos that I put out there. And also make sure to check back on Wednesday, 6 p.m. Eastern Standard Time. I'll go live. It'll be amazing. We'll do some training together. It'll be awesome. And then also, if you would like some helpful tips on how to just feel, move, live better, every Monday, straight to your inbox, I put together a newsletter called the Monday Morning Brief, and I would love for you to sign up for it. It's all free information, just meant to help you overcome frontline pain and have a higher quality of life. So we talk about just strategic ways in which you can combat low back pain. That's the big theme of this month. All right. So I hope that I see you on Wednesday live. Have a great day.